it does not increase your risk of colon cancer. Sometimes people may just have pain in the stomach when they actually have reflux disease. Hello everyone, and thank you for checking us out. This is SAC Health Answers, a program where we answer your questions about health so that we can empower you to make decisions for your health and well-being. I'm Dr. Jason Lohr. Many of you may know me as the CEO at SAC Health, but I'm also a practicing family medicine physician. And today our question comes from Marco. And Marco says, I have chronic acid reflux, or GERD, and I've been taking medication for it for years. Do I increase my chance of colon cancer because I have GERD? I'm worried about the long-term effects. Well, Marco, that's a great question. I think the first thing we should differentiate is GERD, or gastritis, or gastroesophageal reflux disease, is something that's associated with the stomach. The stomach is at the very beginning of the digestive tract. After you swallow, it goes down the esophagus and food enters your stomach. Whereas colon cancer is actually talking about the final passageway through the digestive tract. And so really they're two separate areas of the digestive tract, and there is no association between issues with the stomach causing issues with the colon. So it does not increase your risk of colon cancer if you actually have reflux disease or GERD. The other thing that's important to talk about as far as your reflux disease is that is a very common thing. A lot of people suffer with reflux. That is when acid comes up from the stomach into the esophagus and can cause a burning sensation or a pain or just a discomfort. Sometimes people may just have pain in the stomach when they actually have reflux disease. Now, there are certain medications that we can give for reflux, and I'm sure it sounds like you're on one of those medications. But we also want to make sure that these medications are not given forever. There are many times where we as doctors will start a patient on a medication and we'll keep it for years and years. And there are times where we really should be trying to wean that medication off or even remove that medication, because long-term use of any medication, we have to justify its long-term use. There are several risk factors for colon cancer. One is just related to the age. So we start screening at age 45, maybe even younger, depending. And then also your personal or family history. If there is a family history of colon cancer or polyps, then we need to know that so that we can appropriately screen. Diet also has a role in causing colon cancer. We know that more processed foods and actually more meat in the diet increases the risk. And fiber, vegetables, and fruits actually decrease your risk of colon cancer. So we really want to highlight the ability to even prevent colon cancer with a healthy diet. Lifestyle, we know that obesity, we know that smoking, those things can increase the risk of colon cancer as well. And then if you have an inflammatory bowel disease, these are issues where the bowel becomes inflamed, like ulcerative colitis or irritable bowel or Crohn's disease. Those issues can also increase your risk of colon cancer. So very, very important question. Again, we highlighted both reflux disease and highlighted colon cancer. We do want you to connect with your primary care doctor for either of those, because very, very important for them to talk to you about both the medications that you're taking for the reflux disease, as well as how to prevent and screen for colon cancer. Remember, your primary care doctor is your partner in healthcare. Any questions you may have, please ask them. Thank you for joining us on this episode, and hope you can join us again.